hospital's 100th anniversary, and they put together a whole series of lectures for the general public running on the evenings. My name is Jim Gauthier. I'm the head of microbiology down in the laboratory. My background, just to give you a little bit of background as to where I'm coming from, and I don't profess to be an authority on AIDS to start, but I do have an extensive 12-year background in microbiology, working in a clinical laboratory and seeing aspects of life that the general population doesn't. And where a lot of my awareness came from with HIV was through sexually transmitted diseases other than AIDS or HIV. I've worked in laboratories that diagnose diseases that are transmitted through sexual means, and I see the population that get these diseases. And as much as we would like to believe it's people that know better, it's generally not. 15 to 19 age group. Some of the higher age groups, it generally spreads up to about 24, and then people catch on. From that, I developed a bit of a background. I also have a background in a subject called infection control. I've obtained a certificate in that. Not that that gives me any more knowledge on HIV testing and stuff, but it has given me an awareness of disease transmission. And these are some of the areas that I will touch on very briefly. I want to keep the formal part of this, with me standing here talking to you, as brief as possible, touching on the 5 topics I have on the board. And then really what I would like to do is try to generate some discussion, roundtable. If you have specific questions that you want to ask, please, you can't embarrass me. I've come awfully close once, and I can get into that. But it takes a lot to embarrass me. So if there's any question at all, I've never ever been asked a stupid question either. There is no such thing as far as I'm concerned. If it's a question to you, I would rather straighten it out in your mind. What we are talking about tonight is AIDS, acquired immunodeficiency syndrome. AIDS is the disease state. What happens? AIDS is caused by a virus called the human immunodeficiency virus, HIV. When we do our blood testing and that kind of testing that you read about where people want to have a blood test done, what we are testing for is the HIV virus. And this virus, when present, doesn't automatically mean you have AIDS. What happens is when you have the virus, it starts affecting your immune system, the system that fights off disease, and that is always present and ongoing with these little battles as we come across bugs in our day-to-day life. And as this virus gains a foothold in the body, you eventually start to get other diseases that normally, if you had a good immune system, you would have no trouble with. And when you start to develop these other diseases, that is when we start to diagnose people as having AIDS. So they are actually sort of 2 distinct entities. One causes the other. AIDS is a manifestation of having the virus. Transmission. Still, to the best of medical knowledge nowadays, I mentioned that because I've had arguments with people constantly on this, that, well, what happens, say, in 10 years if they find out everything I say is wrong? To the best of knowledge today, AIDS is still only transmitted through sexual transmission, blood products, and mother to child. 3 ways. The only way you're actually going to come in contact with AIDS is, generally speaking, as the general population nowadays, is through sexual contact and an exchange of bodily fluid. There are sexual contacts that one can have without exchanging bodily fluids. If we start exchanging fluids, primarily semen and vaginal and cervical secretions, we then start running into the risk of acquiring AIDS. You cannot get it through any other means that I can think of. Things that we discussed previously as we were warming up here, you can't get it by kissing, sneezing on people. It's not transmitted in urine. It's not transmitted in feces. Handshaking, sweat, not transmitted. It is transmitted through very specific body fluids, the prime one being blood. In the hospital setting, all the emphasis recently has been on blood transmission, whereas a lab technologist, I work with needles. I take blood on people. I may have taken people's blood here, I don't know. And when I have a needle that has come out of a patient's arm, it has blood on the end of it. If I stick myself, I'm then going to transmit problems to myself if that blood is infected with a bunch of different things, let alone AIDS. Blood was a big problem prior to 1985. We were not screening blood products. The Red Cross did not have a test until spring of 1985. People that received blood products previous to that, and that would be blood transfusions and hemophiliacs, we're at a very, very high risk of acquiring AIDS. And unfortunately, we killed a large number of hemophiliacs from contaminated blood products. It was a crime that we just didn't have the testing. It's a new virus. We weren't aware that it was present. Now that we have the testing in place, the blood supply is considered as safe as possible. I cannot say to you there is no risk from a blood transfusion. But we do now screen for the virus. We also screen donors before we take their blood. We ask them, there's a list of about 10 or 12 questions now that we try to make sure no one has participated in what we call high-risk activities. Let alone the sexual side of things, we're also talking about things like tattoos, ear piercing, other things that you might use a dirty needle. And if the needle hasn't been cleaned properly, pick up the disease. Most of these areas, ear piercing, tattoo parlors, are now using disposable needles. So this risk is now also minimized. So the transmission, and I'll get back to this because I think people will have questions on it. It is something to always keep in mind. Something to keep in mind is that it is very, very difficult to get AIDS. Very difficult. Unless you participate in what we call risky things. The risk groups nowadays, I had someone gave me some literature from the 6th annual British Columbia AIDS Conference. And the statistics in there are saying that the highest risk is still your homosexual or bisexual people. Men that have sex with men, or men that have sex with men and women. Women that have sex with men and women also are considered bisexual. Where we're now starting to see another high-risk group is intravenous drug users. People that inject drugs into their veins. Because they tend to share needles. Somebody will have a needle, they'll pass it around, everybody will inject their drugs, transmit blood. What also this book was saying is sometimes they'll draw enough drugs for 5 people and pass it down the road. Everybody aliquots out their drug. That is where we're getting a large transmission right now, is in the IV drug users. Recipient of blood products prior to spring of 1985. Anyone that received a blood transfusion prior to that date, if they are not HIV positive now, probably will never convert. And I'll talk about that under testing. Sexual partners of HIV positive individuals are at high risk, depending on how they practice, sex, to put it simply. And sexual partners of these high-risk individuals. And obviously children of HIV positive women are still being infected. The risk groups that I consider now, where we're seeing the biggest surge in positivity, is in the heterosexual population. Because a lot of people have always assumed that, well, if I don't have sex with another man, I'm never going to get AIDS. But they don't stop to think that if they go out and have sex with a different woman every weekend, maybe wear a condom if the woman doesn't look too great, not wear a condom if the woman looks healthy and decent and church-going, these people are at an extremely high risk. This happens. How many times have I seen on TV people say, well, I don't use a condom if they look all right, or I can tell if someone has AIDS. You can't tell if someone has AIDS. You can't tell if someone has HIV virus in their body. I could be infected now and stand up here, look healthy, I could go down and do 100 push-ups and still have HIV virus. I could be well into full-blown AIDS and have a bunch of systemic diseases that are affecting all parts of me and still look perfectly healthy. And if I didn't know my status and was having unprotected sex, or donating blood and having it passed on to other people, I could be very high risk to other people. Testing. The blood test for HIV detects your body's response to the virus. When the virus goes into your body goes, whoa, there's a foreigner in here, develops antibodies to that virus, and the test detects the antibodies. So it's your body's response. Your body takes time to respond to the virus. What I like to use when I talk to groups is about a 6-month window maximum, from the time of being infected to the time that your body recognizes the virus and forms the antibodies. It can be as short as 2 weeks. The statistics that I saw in the conference from 1992, November, were 2 weeks to 4 months. I like to tell people 6 months. So testing, I can go in, have a blood test, and be negative today and turn positive tomorrow. I can be tested today, turn positive next week, next month, 6 months from now. So a negative test, a negative HIV test, does not mean that you are not infected with HIV. Again, if you're from one of these risk groups. If you don't have any risk factors, if you've never stuck yourself with a needle, which I have done on occasion, luckily I've never converted from that. I don't practice in any high-risk activities, as far as I know, that I am aware of. I don't really have to go out and get HIV tested. I don't fall in there. To go out and have a negative test just to make me feel better, some people do that. Just because they think, well, you know, if I went swimming in the lake and somebody else had swam in the lake and had HIV, I may have picked it up. Then they want to go off and get a negative test and feel better. That's fine. You know, if it's going to make your mind at ease, do it that way. The people that I target, when I go out and I talk at conferences, when I'm in school at a conference and I get up in front of my class, what I try to remind these people is, just because you went out or you meet a young lady at a conference and you say, hey, you know, let's have a good time tonight. Have you had an HIV test recently? She said, yeah, I just had one yesterday, it came back negative. That doesn't mean she's not infected. There's what we call and like to refer to as a window period, 6 months. So what I tried to explain to the single young men in the audience when I was talking to them is you start a new relationship. You both go out, have an HIV test, it's negative, you still practice safer sex or abstinence, which is probably the best way to go, for 6 months. Now, assuming that both members of this relationship have been monogamous or haven't practiced any sex at all, after 6 months, have another blood test. If it's still negative, then you can proceed, especially if you're getting married or something like that, you can proceed to have quote-unquote unprotected sex. This is assuming everyone was monogamous, having only one partner, and didn't participate in any other high-risk activity, sharing needles in particular. This tends to floor a lot of people that there's this 6-month window period. It's really unfortunate tonight that there's not a lot of teenagers here. They're the target group. This whole conference syllabus, which is half an inch thick, their main focus on here is prisoners in jail. They tend to have a high population in jails right now with HIV. Just because you go to jail doesn't mean you get it. But what they're also realizing now is the largest number of people that are now positive with AIDS, with the actual disease, are in the 20 to 29 age group. And with the window that I've been talking about for testing, and from the actual time of being infected with the virus to developing AIDS, they're realizing now that this group that are now positive all got this disease in their teens. And this is the group we have to target, teenagers. 15 to 19 years of age is what they usually refer to. Now, working in the laboratory, I've seen children come in with sexually transmitted diseases that they pick up on their own accord. I'm not talking abuse, that's a different category entirely. But I've seen children, 12, 13 years old, with sexually transmitted diseases. This is why, as a microbiology technologist, I wrote a letter to the editor about condoms in the high schools, saying, teach abstinence, teach the kids not to have sex. You know, force that on them, save it for marriage. Failing that, if they're going to have sex, make sure there's condoms available somewhere. Because I'm the one that has seen the sexually transmitted diseases 12, 13, 14, 15 years of age. Those are the ones that really scare me. These kids are at a very high risk. They're invincible. You know, I talk to teenagers all the time about drunk driving and drugs and that kind of stuff. These kids are invincible. We were all invincible when we were teenagers. We all did stupid things when we were teenagers and survived because we're here. We were lucky. It doesn't take a lot. There's so many things out there that can get us that you just tend to ignore all of it, as far as I can tell from talking to teenagers. The time from actually becoming infected with HIV to developing AIDS, the average tends to vary and fluctuate. Right now they're saying it's about 8 years is the average, 8 to 10 years that you can be infected with HIV before you start showing signs of AIDS or start picking up all these other infections. When they classify someone as actually having AIDS is when they show unusual diseases. The first ones that were talked about that you may have seen in the paper were Kaposi sarcoma, which was a cancer that was very specific to elderly men. It used to show up in the legs and this kind of stuff. And that's what they started to recognize in San Francisco with the homosexual male population. These young men, healthy, were coming down with this really unusual cancer. And they found that that now is considered one of the signs of people developing AIDS. This list keeps changing. As they get more and more information about the disease, they realize there's more and more what we call opportunistic infections. Bugs that we could all come in contact with and probably do every day. Organisms that you'll hear names mentioned like Pneumocystis carinii pneumonia, or PCP. We've all potentially been exposed to that and may have a short 1-2 week flu-like illness. And then we get over it. Your body goes, oh right, I know how to fight this off. Kills it. You don't even know what's going on. You have a fever for a couple of days. In an AIDS patient, they can't fight it off. The body cannot respond to invaders anymore, and the infection will then take over their lungs and cause quite a problem. There's a whole list of different diseases now that they're starting to use as a marker that someone has gone from being just HIV positive to actually having AIDS. That's the scientific, technical side of it. There was a doctor that came down from the BC College of Family Physicians and talked to the medical staff here. and he handed out this HIV counseling checklist that when a patient comes in and asks for an HIV test, I go to my doctor and I sit down and say, doctor, I want to have an HIV test. There's a list here of about 12, 14 questions that they now recommend that you ask this person. You know, why do you want the test? What are your concerns? Do you understand what a positive test means? Do you understand what a negative test means? You know, you're supposed to discuss the benefits of testing, the risks of false positive tests, the risks of false negative tests, because this does happen. Identify risk behaviors. What are people thinking that they're doing that is causing a problem? It's a very interesting checklist. And then on the other side of the paper, there's a checklist of approximately 8 things to sit down with the patient when you're giving him the test results. This doctor recommended that no one be given either positive or negative results over the phone. That you actually make another appointment, the patient comes in and you sit down and explain to him. Granted you have a negative test, but then you go over all the things that this means. Doesn't mean you don't have HIV. Doesn't mean you can run out and practice unprotected sex. Doesn't necessarily mean you can run out and donate blood, for that matter, if you belong to a high-risk group. I like the idea of it. I see too much people just coming in to have a blood test. They participated in one high-risk activity and they want to make sure they didn't pick up the virus. Well, that's pretty naive when the patient comes in and describes that to me in the laboratory. I'm thinking, well, that's fine, this can come back negative. But are we going to see you in 6 months again to have another test to show that, no, you didn't pick up the virus, assuming you didn't do anything high risk in the interim? You also have to understand that there is this window period for the test to go positive. And I think that's really important to try to explain to teenagers that might want to run down to the clinic and have a test done to make sure they don't have HIV. That maybe is not being fully explained to them why it's important to understand that there is this window period of testing. Does anyone have any questions so far on what I've touched? I feel this is always the technical side of getting through the HIV. No questions?
Well, sort of, I don't know. Well, like, you say they test blood, like at Salvation or whatever, Red Cross, you talk about a window period. So they, what if they like test that blood, say they took the blood yesterday, and then you say it takes 6 months to show up positive?
What they've tried to do at the Red Cross is they give you a list of questions, and they say, are you homosexual? Are you an IV drug user? Or have you used intravenous drugs in the past, I think it's 6 months? You know, have you traveled to a malaria country? Like, you know, they don't all focus on AIDS. A lot of them focus on malaria and hepatitis also, because hepatitis has a smaller window, but hepatitis also has a window in there too, where you can test a unit of blood that someone has donated as being negative for hepatitis, and it could be positive. So what the Red Cross and this hospital, because we will bleed our own donors, we can't keep a lot of blood downstairs, we have a list that we go through. And all we do generally is we hand the list to someone. We don't ask them these questions specifically, but we hand it to them and say, if you can answer yes to any of these questions, please, we don't want your blood at this time. And that way I don't have to find out if someone is homosexual or an IV drug abuser or had traveled to Colombia to someplace that had malaria. We can just say, okay, you're not suitable for blood donation at this time. I really don't have to know why you refuse to have your blood taken. And this is as far as we can go. We have to use blood. And there is always a certain small risk of a blood transfusion. We don't do blood transfusions willy-nilly. You know, we make sure that someone desperately needs to have their blood volume brought up by giving themselves. We have blood products that are heat treated that will remove the risk of infection with any virus. They can treat them through several different means to make sure that the product itself is not infectious. They're now doing that with the products that are used in hemophiliacs, cryoprecipitate, to make sure that the virus will not survive. When I was immunized against hepatitis, all hospital workers now, and people that have the potential to come in contact with blood are getting immunized against hepatitis B, which is the infectious one from serum. And when I got immunized, the anti-serum was made from blood taken from homosexual males in New York City, because they have a high prevalence of hepatitis. That's always been a given with homosexual males. And so what they did was take all these guys' blood, pool it together, and then heat treat it so that it was not infectious for hepatitis, but your body would respond, form antibodies to the hepatitis. Well, when this first came out, this was just when AIDS was starting. This is back in 1982-83. AIDS was just starting to appear in the paper as a problem. And I thought, oh wait, I'm a little hesitant. I'm a microbiology tech, I should know better. And I watched everybody get their shots and nobody dropped out of AIDS. Not that they were going to, you know, there's a heck of a window period there, but the product was perfectly safe. They had treated it in such a manner that nothing could survive it. They ran this stuff through formaldehyde, and heat treated it, and they filtered it, and by the time it got to you, all it did was make you react to hepatitis. So if I'm ever exposed to hepatitis through a needle stick, hopefully my body will be able to fight it off. We don't have anything like that yet for AIDS. As far as I understand, the vaccines for AIDS are not anywhere near. It's going to be a while. The virus itself is rough to work with. There vaccines, I would guess, I don't know if anyone has an actual number that they've heard of, but I would guess anywhere from 5 to 10 years at the earliest to get any kind of a vaccine for AIDS. So yes, there is a risk from blood transfusions, minimal. We are trying to screen, and what we are always emphasizing to people in the laboratory is do not give a unit of blood to find out if you have HIV, because we do test all units for HIV. And some people were thinking, well, this way I don't have to go to the doctor, I can just give a unit of blood and they'll test it. Well, that's real dangerous if you're in a high-risk group, as you stated, because there's that window period. If you want to have an HIV test done, you cannot ever, ever embarrass your doctor. I have this talk with teenagers. If you have something wrong with your body, talk to your doctor. You can't embarrass a medical doctor. That's what those guys are there for. They've heard everything. And they don't respond, they do not judge anyone. They hopefully try to fix the problem as ongoing.
I would like to know if a person decides to be tested, which sometimes, particularly if you're in a high-risk group, you're hesitant maybe about getting tested because you know if you test positive, you're going to find out that you have a disease that's going to kill you, that there's no cure for. So if you do come to the point where you decide to be tested, who knows, where do you send the blood? Do you test it here? Do you send it somewhere else? Who exactly knows that you are HIV positive? You, the doctor, and the lab that tests it, or how far does the information go about the patient that is HIV positive?
That's a good question. Confidentiality in the hospital in general is a very strict issue in terms of confidentiality. Punishable by all kinds of things, and it should be. No one should ever find out, especially in a small town. I run into neighbors, friends that have come into the hospital for one thing or another that I am not at liberty to go home and discuss with anyone. That's confidential. HIV testing now is all done at provincial laboratories in Vancouver. All the information the provincial laboratory in Vancouver needs are the initials and the doctor's name. So I can go in and have testing done, and all they need on the requisition that goes down to provincial lab and on the tube of blood are my 3 initials, JAG. We will put down birth date because that helps to follow it up when you have 3 JAGs come back, which in a small town is not a big problem. And again, there's not that many JAGs that are going to see Dr. Barber in this town. So when the results come back, nobody knows who's positive. Unless the person who took your blood remembers that, hey, right, JAG, that's Jim that came in. And the person that actually takes the blood has absolutely, in our hospital, in our laboratory, now that you've mentioned this, has no contact with the results coming back from Prov Lab. The results that come back from provincial lab, first of all, I've never seen a positive HIV test come back to the laboratory. I believe it is mailed directly to the doctor. And with a disease like that, they will not phone it to the doctor's secretary, they will phone it to the doctor. So it's not even like you have to worry about the doctor's secretary, who again, and the doctor's nurses, they're all, we take a pledge every year at the hospital on confidentiality. So it's not a problem to worry about. So you can have testing done with your full name. I personally would not care if I'm having HIV testing done. And actually the only time, I'm trying to think if I've had HIV testing done other than for being a blood donor. I'm on the donor list at the hospital, so I get screened every 4 months as part of an ongoing thing that we do with all of our donors. The actual people that then know basically are your doctor and yourself. Because provincial lab has no idea who this is with 3 initials. They can't even look it up on the phone book.
But if somebody was coming in for an operation, or if somebody was brought in an emergency operation, and the staff felt that they were definitely a high-risk group, they can't test that person without their permission, can they? They would just have to take precautions if they felt that that person was a high risk.
Right. You've covered 2 different things.
Yeah.
And I'll touch on both of them. No, we cannot test people's blood without their knowledge. We have to have informed consent. So if you come into the hospital, you've got night sweats, fevers, chills, you're losing weight, they don't know what's going on, the doctor cannot just order a battery of tests. He can't do a blood count and a bunch of chemistry tests and send some urine down to Jim in the microbiology lab and order an AIDS test. He can do all of the first 4 except the AIDS test. He has to come and say, listen, you've got signs and symptoms, I want to rule out HIV. may we take your blood for that test? You say yes. Away they go. You say no, we don't take it. If I'm taking blood off you in the outpatient department, and as I take the needle out of your arm, I turn it boom into my hand, I have to ask your permission to send your blood off to be tested for HIV. We cannot send down your blood without your knowledge to be tested. So anytime your blood is being tested, it has to be with your full consent. To my understanding. Now, if there is a variation on that, I would love to find out. But as far as I know, and this has happened to us, unless it's totally anonymous. We had an accident in the laboratory where we had anonymous blood that we then sent down to be tested, and we labeled it as anonymous blood from needle stick. And if it had come back positive, we would have no way of tracing where that blood had come from. There's been some very rare cases of people using someone else's name on the tube of blood so that their name would not go down, worried about this exact issue. And at least in this province, we've taken care of it because the lab that does the testing is fully ready to accept a tube of blood with just initials and a doctor's name. 2 pieces of ID. Whereas any other blood tube that we take, if any of you came into our outpatient lab, we have to have 2 pieces of identification on that tube, including your name. So generally it's your name, your birth date, and our indication of the date that was collected and that kind of stuff that was collected in outpatients. But we have to have 2 pieces of ID.
The reason I asked that question is because I don't know of British Columbia, but back east, for instance, in large companies that have employees that are on, say, a disability pension. Say they have an insurance company that's covering if you get sick and you're at disability. So they come in, the insurance company comes in and says, we want a urine sample and a blood sample, and we're going to check for this, 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 and this. Do you mind if we check for the HIV virus? Well, of course, the person says no. Then they get very suspicious. I mean, I know this firsthand. And then if they say yes, and they find out that they are, they cut off their disability insurance, and they haven't got, So I'm just curious about. It's a different issue again, but still, I was wondering about the hospitals.
HIV testing, or HIV itself and AIDS has opened up an area of medical legal issues that are quite concerned. Generally speaking, a doctor cannot refuse to work on a patient, knowing their HIV status. So if a patient presents to our emergency room and says, I am an HIV positive, a doctor, as far as I understand it to this date, does not have the right to say, no, I don't want to treat you. And this is why I go out and do education, because that doctor's fear is unfounded. Unless he is actually performing a surgery where he cuts himself and gets tons of blood into his finger from an HIV positive patient, other than that, he really doesn't stand much risk from that patient. It's not easy to get. There has been talk in the United States, and I made a note while you were talking on testing, of healthcare professionals. Everyone heard of the case in Florida. Dentist theoretically gave AIDS to 5 patients in his practice. They're still split on how that happened. One half is saying that the dentist who is HIV positive bled into his patients and gave them HIV. That's one half of the theory. The other half of the theory is it was his equipment was dirty and transmitted the virus to the patients, probably through his drills or whatever. They will never know. The dentist had anywhere from 10 to 12 HIV positive patients in his practice, but they have no record of who he saw when, so that he could find, so we could look back to his records and see if he did a tooth filling on an HIV positive patient, and then one of these poor, unfortunate people came in right afterwards, and he just wiped off his drill and used it again. You're finding now, as you go to your dentist, that these dentists are now sterilizing everything that they use between patients. They've always maintained a very high level of cleaning of their equipment, but they've taken it one step further to make sure that things are being cleaned. The other thing that I have to talk about and address is what in the hospital we call universal precautions, where we treat everybody the same. We try to. It doesn't always work. But I work under the assumption that every blood specimen I handle is positive for HIV and hepatitis. And that way, I treat them all exactly the same. I don't need to know when a patient comes into the hospital if they're HIV positive. It makes no difference to me in the work that I do. There's a couple of, say, down in the pathology lab, it may make a difference as to why someone's tissue or blood is unusual. The pathologist, it will help him with his information. To me in the laboratory, do my microbiology work, I don't have to know. I see so many patients that have similar problems that an HIV positive patient will. Someone that is on chemotherapy for cancer, their immune system gets wiped out. they can be exposed to a multitude of different organisms that can cause a problem. So all I need to know is that their immune system is screwed up, immunosuppression. I don't have to know why. I don't care if it's HIV, I don't care if it's chemotherapy, I don't care if they're just run down, they're low compromised. I have to look for different organisms. That's the only thing I have to know. Some stuff I have to incubate a little longer or look for fungus or something weird. But I don't really, to me in the lab it makes no difference at all. If I have a tube of blood that I'm working on and I drop it and the thing shatters, let's treat it as though it has AIDS and hepatitis. You know, why should I worry that, oh well, that came from the lady that's working next to me, and I know her, so I'll just pick it all up and throw it away. That doesn't make any sense to me at all, with the window period. You know, and I don't know what she does in her spare time. So we treat everything as much as possible in the hospital under this thing called universal precautions. So that when someone presents to the emergency room, if they're bleeding, you put on gloves. You wear some protection on your face. You've noticed now in any American show, anything that shows an emergency room, these guys have masks on, they have their visors on, their gloves and their gown, and it's waterproof. And we've been trying, as infection control people, we've been trying to get them to do this since the early 70s, when hepatitis was a big problem. But everyone went, hepatitis, you turn yellow for 3 months, so what, who cares? Not realizing that it kills like 200 people a year in the healthcare field, hepatitis. HIV is very hard to get from a needle stick. If I had blood from a patient that was positive with hepatitis and stuck myself with that needle, I have a 30% chance of getting hepatitis if I didn't have my little immunization. With an AIDS patient, if I had blood from an AIDS patient and I injected myself, it's about 0.3%. About 1,000 times harder to get HIV.
Really? Mm-hmm.
Really. So, and that's injecting what they can call, quote unquote, a fair amount of blood. What they're finding is that surgeons that stab themselves with, like what we would use for darning needles, that aren't hollow inside, have even less risk, because you don't put as much blood inside. As when I take blood from a patient, my needles actually have a hole in the middle, so we get the blood through it. They hold a little bit more blood, you get it inside yourself. The volume is a little higher. To date, there's been one healthcare worker in Canada that has been confirmed with getting HIV from the job. One. In thousands of needle sticks. Thousands. In Canada. In the States it's higher. I think it's around 160, 200. I'm not even sure of the number in the States. It wasn't mentioned in any of the literature. It's very hard to get HIV, even if you stick yourself with somebody else's blood. It's actually quite difficult to get HIV from having sex with someone that has AIDS. Heterosexual contact. It is difficult. But what they're finding now is that with the number of contacts that are going on and the number of people that are being positive, your risk is increasing in the heterosexual population. And again, the homosexual population and the bisexual population learned real quick that this disease kills. They saw their buddies dying. They've taken measures. You don't find as much promiscuity anymore in the heterosexual or in the homosexual population. The heterosexual population, as I like to refer to it, are the people with their heads in the sand. Not going to happen to me, I'm not gay. It will. If you fall into certain, very certain, high-risk activities. My mom sent me a letter today. Funny, it arrived tonight. The clipping from a newspaper down in Florida. And what it was a little article by a columnist that's syndicated that I'm probably going to write to. And she was applauding a school board in New York that threw out the head of this school that wanted to put condom machines in the school and teach condom education. Now this guy apparently was aiming it down to like grade 6, which I think is a little early to get into that kind of stuff. But the parents group got up in arms and threw it all out. And they said, we're going to teach abstinence and that's the best way to go. Because it worked with drugs. Just say no. And I stopped and thought about it through supper tonight. And I thought, with drugs, we see the effects. Drugs have been around for a long time. It's been a big problem from the late 60s, actually early 60s, through the 70s. You get to see the cumulative effect. We've had, let's say, 30 years of experience with drugs. We know they kill. We know they screw people up. You don't achieve as much as you would like to achieve. We've got the background. We all know somebody probably that got screwed up on drugs, some way or another. Not all of us know someone that has AIDS. We're head in the sand people still. We're still saying, not quite out there. We know the homosexual population is dying from it. So, so don't push the condom machines. It's not here yet. Let's not worry about it. What I'm saying, and the number that came out of this this book is, of the 20% of Americans that have been diagnosed with AIDS, they're in the 20% of them are in the 20 to 29 age group. That's 45,000 people in the States that are with AIDS. The number I always like to use is, that's 10% of the number that are positive with HIV. That statistic is probably a little off. But they're estimating, I think it is estimating, somewhere around 1.2 million people in the States are now HIV positive. Of the prostitutes in New York City, I think it's 1 in 20. In Thailand, the prostitutes, is basically they're all infected now with HIV. It's out there. And it's not just, for the age group that's present in this room, it's not a risk, I would be willing to say. We've got the experience under our belts. I think that even if we were single and going into a new relationship, hopefully my talk tonight will give people ideas as to what they need to do or what to worry about. It's the teenagers. Anywhere up to the age of 20. We've got 8 years that it's going to take for these people to develop AIDS. We've got 45,000 people in the States now that have it, that were infected when they were teenagers. 8 years ago. It's there. I don't know why people keep thinking it's not going to happen. I can think of 3 HIV positive patients that have been through this hospital in probably the past week and a half. It's in the community. It's not a risk to anyone. If you follow a couple of small recommendations. If you're going to have sex with someone that you don't know, make sure it's very well protected. Better way, don't have sex with someone you don't know. Get to know someone. Take some time. Get married. Not a problem then. Other than that, don't get born to a mother that has it, which doesn't affect anyone here. And don't do IV drugs. These are the ways you're going to get HIV. My mother-in-law stops last night and says to me, "But Jim, what if the chef at the restaurant is HIV positive, cuts himself making the salad, drips all over the salad, and I eat it?" And I said, well, first of all, the amount of blood that you're going to need to get HIV will be visible, and hopefully you don't eat bloody lettuce when you go out to a restaurant. Unless you have French dressing on it, it's going to be hidden. Yeah. The French dressing has a lot of vinegar in it, which, if I did a bunch of research and probably tested it out, the vinegar is probably sufficient to kill the virus. It's not that hardy. It doesn't hang around all that much. On top of that, you then have to get the virus into your bloodstream. Now, if you're just eating it and you haven't had any teeth extracted recently and your gums are fairly healthy, and again, you probably have to gargle with a mouthful of blood with the tooth missing to have a risk of picking up HIV. The virus is not going to get to your stomach. Now, if you have a bleeding ulcer, I'm giving you these kind of hypotheses that yes, theoretically, there's an infinitesimal risk. You might as well be buying lottery tickets. You got a better chance of winning the lottery while standing on a lightning rod and getting hit by lightning. Minimal, no risk of that kind of thing happening. In the laboratory, working with another lab technologist, we had an HIV positive patient in the hospital. A urine test came down. All of a sudden, we're treating it differently. And I said, what's wrong? Would you like to treat all urine specimens this way? And they're saying, well, not really. And I said, well, the virus isn't present in urine. You can drink this stuff, pour it onto your skin. Not going to cause a problem. Well, that's right now. What happens if they find out in 5 or 10 years that it's a problem? And I'm saying, it's not a problem. If it was a problem, we'd have a heck of a lot more people infected right now. Where a lot of this research comes from were children infected with HIV that were living with other people. And these people would share toothbrushes, get into fights, get bitten. No one ever picked up HIV from someone that had either HIV or full-blown AIDS. As you get AIDS and develop, you get the virus back in your bloodstream in a lot higher numbers. People aren't picking it up through quote-unquote casual contact. The people that are picking it up are doing the high-risk stuff that I talked about. And I can't emphasize this enough. You don't get it from toilet seats, doorknobs, kissing, sharing glasses. If anyone here had HIV, and one of the questions I like to ask people, I'm going to sit down and rest. When I go out to conferences and stuff, generally what I'm asking people is, would you work, to other union people now, would you work with someone that has HIV? And if you at all hesitate to say, not a problem, what's your concerns? Talk to me. Because there should be no concerns. So I had one of the instructors at my course say, well, Jim, how about if I was the first aid attendant at the industry that I work in? I work for ferries. So I have this first aid attendant, and there's an accident, and he gets hurt, and gets cut, and he's working with somebody else that has a cut, and he gets his blood into that guy's cut. And I'm going, and you're talking about a potential risk. Granted, there is a risk there. But at the same time, as a first aid attendant, anybody here ever taken CPR? Anyone?
Practice industrial first aid.
If you've taken CPR, they've always taught you, check to make sure they don't have a pulse. Because if you do CPR on somebody that has a pulse, you put them into an arrhythmia and a problem. So because there's the potential for this first aid guy to do CPR on someone that still has a pulse, should he be restricted from doing first aid attendant? It's the same question the guy was asking me. There's a risk there. There's always a risk to some things that people can come up with, but it is so minute that I would not hesitate to have an HIV-infected person being a first aid attendant. There are certain occupations. The ones that the doctor brought up that came to talk to the doctors here were airline pilot. HIV, as it progresses, does affect the brain. It causes a dementia down the road. And what he was recommending is ground the pilots when they find out their status, which I disagree with, mainly because the pilots will then not get tested because they're going to be grounded. And I think each case is individual. Any questions, anything that you had a concern when you came here tonight that I haven't addressed, feel free.
Are you really sure that passionate deep kissing will not affect, because I read it?
What they were saying is that you'd have to swallow a bucket full of saliva that is blood tinged.
Oh.
There's been no evidence of the virus being transmitted in saliva. They have detected it in saliva using special techniques and stuff like that. So there is the risk of virus there. The fluids that can transmit it, besides blood, are usually fluids that are very hard to get at. The only ones that aren't hard to get at are semen, cervical and vaginal secretions, and breast milk. Breast milk, they're now realizing, can transmit the infection. I think it's around 20% of infants that are born to HIV positive mothers that don't get it from birth are now getting it from breast milk. So they're stopping the breastfeeding. Easy enough to fix. And again, a child born to an HIV positive mother, only about 30% of them are infected.
I would like to ask a question about that. I read somewhere that a child can be born HIV positive from a mother who is infected, but it is not necessarily going to get AIDS or be HIV positive all the time. So what is the facts on that?
No, what happens there is when a child is born to an HIV positive mother, because of the way the placenta membrane is set up, they share some stuff in their blood, but they don't actually share blood, but they transfer nutrients back and forth across the placenta. And again, I hope I get this reasonably straight. Mothers always pass on antibodies to their children. And what happens is the antibody crosses over on the placenta, not necessarily the virus. So when you test the child, you're actually detecting the mother's known antibody.
And not the child.
And not the child. And what happens is after a year, the antibody disappears because it's not being stimulated by having the virus present, and the child will then detect negative. This conference actually discussed new testing techniques to try to determine if it's the child's HIV positivity or if it's just picking up the mother's HIV positivity. Good question.
And of course, the fact that women, I've done a lot of reading on women too, and there's been quite an increase in women in AIDS because as a heterosexual woman, we've never felt that, well, our chance of getting AIDS would be minuscule, and have let certain symptoms go by for a long time. In fact, doctors have been at fault too, how many I don't know, but a few, of not testing or even asking women if they would like to be tested for such a disease. For instance, women who have chronic vaginal yeast infections, which a yeast infection is definitely, most males get, of course, thrush and yeast infections in the mouth, whereas women will get it in the vagina. So that there is sort of a lack of education in the female population as well as in the teenage population. Just because you're, a sedate, happily married, heterosexual woman that never goes out and has extramarital sex, you don't really know if your husband is even bisexual, for all you know. And that women, is it true that women can get AIDS easier than men?
Oh, for sure. That question's easy to answer, yes. The vaginal mucosa is not similar, but it's more prone to infection or penetration by the virus through minute rips and tears through friction. And that's why anal sex, the anus was never really set up for that. The membranes lining the inside of the rectum are very friable, or very easy to abuse, and hence you get the infection that way.
Well, isn't that why the homosexual community got the virus so easily and so many?
Yep.
many young men do get virus.
Your original concerns about women, just because, I just want to clarify that just because a woman has chronic yeast infection, she's not HIV positive. A woman that is in a strictly trusting, monogamous relationship has nothing to worry about. But like you're saying, what happens is women get into these trusting relationships and the man around, comes home, and the woman never suspects, and this happens all too often, vice versa. The man never suspects. The woman is out with multiple partners.
But isn't he less likely to
He
pick up the virus?
is less at risk, but not totally removed. And this is what I was shocking people at this conference with, that you have a one-night stand. You come home, you have your blood test, you should be having protected sex with your regular partner for 6 months. Have your other test. And I don't know how you can explain this to your regular partner that all of a sudden you want to use a condom for 6 months. And I had people coming up to me afterwards going, explain this to me one more time about unprotected sex. And I thought, get with it. You know, this has been in the media for a while now. You just can't do it. I like the stuff they always use with teenagers, that you're sleeping with everybody else that your partner has slept with. And they use these lovely flowcharts now where Jane has 3 partners and John has 6 partners, and those partners, and you get into a multitude of people that you're sleeping with when you go to bed. If you're in a strictly monogamous relationship where you can trust your partner implicitly, which there's lots of relationships like that around, you have nothing to worry about. You're not going to get HIV. If there's any question, if you're starting a new relationship, if you've become single, starting a new relationship, be awfully suspicious. You can't tell by looking at someone. And I've heard this. Oh, well, you know, you can tell. I can look at people. I know they're all right. Women, for so long, have been in the minority because it has been a predominantly homosexual disease. 85% of cases, I think, is roughly where it falls. The statistics that came out of the conference is a little over 5% of the Canadian cases of AIDS are women. A little over 5%, but they're estimating that 10% of the HIV positive individuals are now women. And the nurse that actually attended this talk is saying that they figure that will approach 50% by the next 5-10 years. I've talked to other people that said it won't catch up that quick. But the reason women are at a higher risk are poor women and women that have to use sex to get money because they are poor. They're going to be at a higher risk. IV drug abusers, spouses of people that are IV drug abusers. The women have been ignored with it. And they're now using the vaginal yeast problem as an indicator if there's other risk factors. If there's no other risk factors, I don't want people to start panicking that every time they get a yeast infection they got AIDS. It doesn't quite work that way. But this conference actually was aimed at women and HIV because they feel they have been the neglected part of it. Like I said previously, the homosexual population is up to speed on this. It's the heterosexual, and maybe even the bisexual. They now have documentation of transfer from male to male, male to female, female to male, and female to female. They've got documentation and evidence that it goes all the way around, full circle. And again, the gay and lesbian community are up on this. They take the risks, or they don't take the risks. They take protection. They know what's going on. What I'd always like to try to preach to teenagers when I talk to them about any sexually transmitted diseases, don't have sex. It's the easiest way.
But
Failing that, you know, and I'll do as much as I can to talk to them about alternates. There's lots of things you can do without exchanging body fluids. Failing that, have what they refer to in this conference outline as safer sex. Just using a condom does not mean you are totally immune. It has to be used properly. You have to get one of the ones that don't have microscopic tears and rips. Most latex products will eventually have some sort of a problem with them. All condoms are not made equally, shall we say. Any other questions, concerns, rumors that you've heard? I like the rumors, they're great.
I don't think it's rumor, but carrying on from what you said about the female population, I think that's been proven in Africa and many of the third world countries, which is much higher with women, I think, isn't it?
Africa is sad. They're estimating 5 to 10 million infants will be orphaned by the year 2000 in Africa. 5 to 10 million. If you have a map of Africa, draw a circle touching as many coasts as you can. They estimate the people that live in that area will be dead in the next 8 years from AIDS. The African AIDS virus, the one that's causing the epidemic there, is actually slightly different than the one here. I don't fully understand.
a stronger strain?
The one in Africa is actually less invasive. It doesn't cause as many other diseases when you get into the AIDS state. It still kills, but I believe it's a slower progression to the disease of AIDS.
Attention please, it is now 8 o'clock.
Oh,
The visiting
lovely
hours
announcement
are over
overhead.
today. Please leave the hospital by the front door. And security alarms are
I have
activated
that in
on all
here.
other
Just give me a
doors.
second.
Thank you. Good night.
They might as well put that on the tape. They announce that every night when you're in here late.
Probably the same person, do
No. Yeah.
That's what they rotate through.
I wonder if there's less homosexuality in Africa.
Not necessarily. HIV, milder AIDS type. Yes, it is milder in Africa. That's what I just wanted to confirm. The way I understand the epidemic in Africa got out of control is a lot of the medicine men like to inject people. And they'll go into a community and give them the magic serum for the week and inject an entire community with the same needle. I hate using the word promiscuity, but it's just part of their society, I think, that they're more promiscuous. Heterosexual, not necessarily homosexual.
They had it was very good actually, African Puppets Against AIDS, last year at Rosie's Laundromat.
Oh.
And they were young African people travel around giving this. And that is one of the points, of course, is the promiscuity, particularly of the male.
What I find interesting about the promiscuity side of it is there's some countries that don't have as big a problem with AIDS, Japan being one of them, but Japan is it's more open about condom usage. I was going to say condom-oriented country, but that's not what I meant. They're more in tune to, I think, that condoms are readily available, they're readily discussed. It's not a taboo like it is in this country. Heck, as a teenager, as a young adult, I never bought a condom. You know, I remember our university newspaper, 1976, the first year I was in university, full-page ads from Julius Schmidt, condom manufacturer. You know, use this. And back at that time, heck, all we were worried about was gonorrhea and syphilis. You know, we didn't worry about herpes and all the other crap that's running around now. And you know, everybody looks at these full-page ads going, yeah. Ignored it. And there's always this big thing about, buying condoms. Ooh. Some societies, as part of growing up and being adolescent, condoms are there, they're used, they're around, it's birth control. And that's what they use. It's our perspective on things.
Well, our society though was always not, I don't know if you are, it's not the macho thing.
Yeah. What do you mean he's gone?
Yeah, exactly. I mean, unless we're on the bottom.
You
I
have a question?
read an article on Africa, and they said because the hygiene in the Western world is greater, we have showers and all this, and when they live in the bushes, their skin is really infected, and that's what they explained. Because
I think what they're alluding to there is one of the theories that is running around that I have a lot of faith and trust in is that if I took an HIV virus, put it into my bloodstream, I would test positive for HIV because my body responds, produces antibodies, but I won't get AIDS. What they think is that there's a cofactor. You need to have something else present.
Mm-hmm.
What they're feeling in North America is another sexually transmitted disease goes a long way. A tired immune system, using drugs, stress, being burnt out, get exposed to the virus, you can't fight it off properly. Mm-hmm. I like this theory. It makes a lot of sense to me that you don't just have to have the virus. Mm-hmm. It's other sexually transmitted diseases, and this gets back to condoms. If you can stop the sexually transmitted diseases, you reduce the risk of getting AIDS. I don't think you'll stop it unless they're used properly. So I think what they're alluding to in Africa is if you have other skin lesions, you are more prone to the virus getting into the bloodstream. Not necessarily due to hygiene as such, but in your tropical countries, you're biting insects give you a whole bunch of different diseases. Around here you get itchy from a mosquito bite. You may pick up a weird virus. In Africa, you get bitten by an insect, you're going to get either malaria or yellow fever.
That's another question. If the mosquitoes swarm around, can they give us, suck it from there and give us the needle? No.
What they're showing with insects, first of all, is that virus can't live inside mosquitoes. It dies.
Uh-huh.
Viruses like yellow fever, encephalitis, those viruses and stuff live inside mosquitoes, do their life cycle, get re-injected from its saliva. And that was actually in this, I couldn't explain this fully, I just didn't even know you can't get it from mosquitoes. What they're saying in here is that the virus will not live and survive in the mosquito's saliva to be re-injected. It's just not part and parcel of it. So no, you can't get it from biting insects.
That's comforting.
Yeah.
Well, even if it bites you, like, and then right away bites another person's?
What then you are talking about is the amount of inoculum, how much blood is going in. It's not enough to infect you. Even if that virus happened to be there, I think the risk of that is non-existent to happen. I'd probably be willing to experiment on that. I just can't see the amount of blood that's actually transmitted. Usually when a mosquito bites you and causes a problem, the virus is reproduced inside the mosquito and it injects a fair amount. It's not just one single virus that sneaks in, to my understanding. And again, with HIV, it's hard to get. You need a lot of virus to actually get injected. And certain fluids have a lot of virus in them, blood, semen, breast milk. And so that when you do take it in, you've got the risk coming from that. Casual contact with the virus, even with blood injected into somebody, 0.3%, 3 in 1,000 will become infected from it, which I consider a real low risk. It's a lot better than the 30% chance you got from getting hepatitis from contact.
Well, one of the other things is, you know, like I would like to say that my son died of AIDS in 1991, and several of his friends died, and I've always had very close contact with young homosexual men with AIDS, very close contact with them, and visited them and lived with, you know, with my son and his partner. And there was only one thing that I got tested for once that I was nervous of, and maybe I didn't have any reason to be nervous of that, but not my son, but the other young man got TB, which is one of the diseases also that you can get when you have AIDS. And he was coughing a lot, you know, and I was at one time in very direct contact with him. Now that probably wasn't even necessary for me, but I did. That was the only time. I never was nervous about the virus.
What did you got tested for HIV or for TB?
I got tested for TB. It was the TB that I got.
I do that.
You know, I thought, oh, he, you know, it was an accident. He didn't mean to, but we had direct contact. He coughed right in my face. No, I was never nervous for 1 second about the HIV virus, and my son had it for, we think, you know, about 9 years.
Yeah.
And I had a lot of close contact with him. And most people that have the virus and know they have the virus or have AIDS are probably more cautious than the people who don't. They're very concerned about, you know, there's a great concern of most people that have AIDS, of being very careful of, like, you know, not using the same towel and all that stuff, which the other people shouldn't be nervous of, but they're very considerate. Very, very considerate.
Well, we find in the laboratory, and this is documented well, that a lot of times patients will come in and say, I'm HIV positive.
And tell you.
As they sit down. You know, and to me I say, I'm really sorry, it's too bad. Give me your arm. You know, what to do. I take the same precautions with everybody when I take blood. I try not to poke myself. And it happens, you get needle sticks when you work in the hospital. We try to reduce that. We've gone a long way in hospitals to reducing needle sticks. You know, I can't, there's, the one thing that I would not do with an HIV positive person is to have sex with them. And actually, you know, properly protected sex is not a big deal. But other than that, you know, it's funny watching when HIV positive patients, the stuff that I read is that, you know, they all of a sudden people won't touch them. No pats on the shoulder. Or gloves on. And they lose that sense of touch. That's that drives me nuts. It drives me crazy. To not have people that would normally pat you on the shoulder, head, whatever, not touch you anymore. You can't get the virus that way. Sneezing. You know, you could be full-blown AIDS and not, so it's not in that. It's not in those fluids that are coming out. Tuberculosis. You know, we are all still of the age group, basically younger than I think, are starting to not realize that tuberculosis was such a problem. I actually trained at the old tuberculosis sanitarium in Hamilton. So it was there, it was present all the time, but they used to put people away, let their tuberculosis heal until they got their antibiotics, and then we didn't need the sanitariums anymore. Tuberculosis is making a big resurgence, and that could be an entirely separate talk that I could do on tuberculosis. And it is related to the HIV and AIDS epidemic, but not entirely. It's also related, they feel, in a lot of areas to poor and homeless people now picking it up. Plus, we're now getting these bugs that we can't treat with antibiotics anymore. It's now a problem.
Actually, it's quite interesting because right now, you know, we're talking a lot about our healthcare system and not, people saying we spend too much not wanting to lose it and what are we going to do with it and all this sort of stuff. But down in the United States, the population, they have a very high incident rate of tuberculosis, and as you say, it could be another talk. But that is one of the reasons in Canada that we don't, because we have access to a good healthcare system.
Yeah.
And the same with AIDS, I think, too.
But tuberculosis, it's just, I just love it. I've got an article at home from 1989 from the U.S. government saying, we're going to beat TB by the year 2000, no TB by 2000. And they started pulling their money out of TB control. 1991, it's out of control, tuberculosis in the U.S. They consider tuberculosis out of control in New York State. Not epidemic, out of control. And in Canada, we've always had our TB control, where they follow people up. They make sure they take the drugs. We lose a few into the system. If worst case scenario, they put them in jail or lock them up, make sure they take the drugs until they're not infectious anymore. The state started to pull the money out of it, and that's the problem they got into.
So do you think that because of our healthcare system too, that we have a more humane and efficient system for AIDS patients too? Or do you think it's about the same?
It depends on your definition of humane. The problem that I am seeing with AIDS patients, usually your HIV positive patient doesn't show up in the hospital. They're not sick. When they have AIDS, they're showing up at the hospital. And what's happening is the word humane bugs me because we do not treat them as humanely as other patients. As far as I'm concerned, unless a patient has a patient, I'm not saying AIDS, I'm saying a hospital patient, unless they have tuberculosis, there's no reason for any patient to be treated differently. Unless they have absolutely no immune system, and when I walk in with my slight sore throat, I'm going to give them something. Other than that, or if they have some viral diseases that they can cough at me and cause a problem, we don't have to treat AIDS patients any differently. Yet still, to this date, in a lot of hospitals that shall remain nameless, they are treated differently. And it is known throughout staff who is in the hospital with AIDS. What to do? How many patients come through this hospital that have AIDS or hepatitis that we don't know about? That we treat as a patient that came in to have a gallbladder out and they go home. They have no sign. No problem at all. They could have been full-blown AIDS for all we know. Hit it well, not that sick. And we're no risk to anybody because they came in like that. The jokes that first came out with AIDS were pathetic in that, what's the stand? They come out with a new diet for AIDS patients and it's peas and pancakes. The only thing you can push under the door. And that came from a lack of awareness as to what was going on. I hope I don't offend anybody with that joke because it's so true of what was going on. The 10-foot pole. I can't quite take your pulse with the 10-foot pole to find out what's going on here. And that was a lack of awareness. I ran into someone at Harrison Hot Springs that wanted to put all AIDS patients on an island. Block them away. Get rid of them. I'm thinking, excuse me? What's the problem? What is your fear? And that's when we get into homophobia, where everyone assumes it's homosexuals, and then you get this big homophobia thing where they're all scared of anyone that is slightly different and they're going to be recruited and attacked. It doesn't happen, folks. There's no such thing. This book here had a very interesting, I wish I could have attended some of these sessions down in Vancouver, where they're talking about education in high schools, addressing sexuality. That everything in high school, when they do talk about sex, is heterosexual sex. Period. That's all that exists. You do not have the option of being gay. People, again, that's almost an entirely different issue on sexuality in schools and stuff, but it has to be addressed. That there are people that are gay and need the education and may try to hide it. And that's what scares me, is someone that participates in high-risk activities and then thinks that, fine, if I have sex with a woman, if they're a gay man, that they will appear normal, or maybe can switch, or whatever, and all the weird stuff that comes with it. But then we get into the risk of disease transmission. Worse so, there. Whereas people are allowed to admit their sexuality and live with it and be happy with it and have the knowledge that they need with that particular lifestyle, or not lifestyle, that particular sexuality. And we've got the education out there. As far as I'm concerned at this point in time, to summarize, AIDS, I do not consider AIDS a disease of the homosexual or the gay population any longer. It is still ravaging that population, unfortunately. It is now a heterosexual concern, not because of the gay population. I feel it is more of a concern because of IV drug use, is how it's gaining its foothold. Because again, from homophobia, I don't want people going out smashing gays because they gave AIDS to the homosexual or to the heterosexual population. I think it's gained its foothold more so through IV drug use and people doing stupid things with their own sexuality and having unprotected sex. Is there any other concern that people would like to address?
Well, for instance, a person wants to get tested for HIV, how would you go about doing that?
Right now, to my understanding in Nelson, through your family doctor, and that is between you and your doctor. Again, the blood taking are people, we take more HIV testing in this town, mainly because of the high homosexual population. We do a lot of screening. So to us, if you walked in to have an HIV test done, we don't blink. It doesn't mean anything to us, we don't whisper.
Well, in other words, you have to go see your family doctor first.
As far as I know, I do not know if you can get testing done through the family planning clinic on Wednesday nights at the health unit. The other way of doing it would be if you're in Vancouver, Calgary, Edmonton, large cities. They have walk-in clinics where you can go in and be tested. And it's basically you walk in off the street, probably meet with a doctor, discuss it, have your blood taken, and they'll track you down and get the results back to you. In this town, there's no such thing yet as a walk-in clinic except for the Wednesday night family planning clinic. I don't know of anything else. I don't know if you're aware of anything else at all in this town. So basically you have to go through your doctor. Do not, I repeat, do not donate a unit of blood to find out. That is dangerous if you're in a high-risk group. That's deadly. That's how people are still getting AIDS from blood transfusions.
Mentioned the name, but I asked the doctor and he says, he wouldn't recommend it unless you have some signs, he says. But what signs would you look for?
The risk factors. I personally, and
He says to me, you got no signs.
Elizabeth Cole would kill me for this because healthcare costs are escalating. We'd like to do tests that are applicable to people and stuff, but I still feel for mental peace of mind, give somebody the AIDS test, the HIV test. If it's for peace of mind, so someone can say, I think that money is well spent myself. The test is not that expensive in the whole overall realm of things. Compared to someone having a nervous breakdown down the road because they don't know if they're positive or not, they don't want to get the test, do the test.
Well, if you, for instance, the medical plan never paid for it, you paid for it himself, I mean, how expensive is it, or how much does it do?
I would estimate the tests would not be more than $25, maximum. I can't even imagine it being that much. I would probably guess it's under $15 to do the test. It's not an expensive test. I would discuss, if people are going to their family doctor and they're saying, you're in a monogamous relationship where you don't have sex at all, you don't do IV drugs, you've never received blood products, there's no reason to have the blood test done, and that's not good enough for the patient, I would recommend the patient to say to the doctor, I want the test done. If it comes to the point where people have to pay, I think a lot of people would be willing for that peace of mind to have a negative test. The education is there, and I can sit and talk to people and say, you have no risk factors. You've never been exposed to the virus. I've never received blood products. I don't have sex outside of my marriage. I don't do IV drugs. I haven't stuck myself with a needle in the hospital for years, thank goodness. What are the risk factors? My mother never had AIDS. I don't get in contact with breast milk. There's a good argument for me never to have an HIV test. If I was losing sleep because I don't believe this guy that sits up in front of me saying that I don't have any risk factors, get the test done. I would rather see people have peace of mind myself over it. There is a lot of misinformation, and a lot of people are going to sit and say, that's fine, Jim, for you to say this, but what if they find out in 10 years that you can get it from exhaled air on buses? Listen, they wanted to fumigate all the buses on one talk show in Vancouver. 3 times a day, take them in and fumigate them.
Well, I have a concern. My biggest concern is the fact that, it's great that people like you are willing to talk and educate people. And my biggest concern is that young people in the high schools be talked to about it, and like you say about sex education for people who have a different lifestyle, Because in the age group, my son was 32 years old when he died. He went through it was just unbelievable just to come out and have to admit to himself that he was homosexual. In fact, the suicide rate among young people when they find out they are homosexual is very high. Then to go through an epidemic of AIDS and not even know that this epidemic had started and not be given the opportunity to have even protected themselves or be educated about it, and now hundreds and hundreds are dying. You know, to have 7 friends die in
Mhm.
1 year, and all of them are between the ages of 25 and 35, you know, I mean, so I really have a concern that people speak out and educate young people, because unfortunately, young people are having sex younger and younger. No matter what we say or do, they're doing it.
And I don't know where that all comes from. You know, I would like to believe that my parents,
I don't know where it comes
when they were teenagers and stuff, that a percentage of their friends, I would like to believe that none of them had sex in my parents' age group until they got married.
How old are your parents?
65, 66. So I would like to believe
I'm
that
55.
when they were in their teens, shortly after the war, all the guys came back, that everybody got together at these dances and no one had sex. I'd love to believe that.
No, they just had sex, got pregnant, got married.
Right. And my oldest brother does not attest to that. Everyone does rapid calculations though. I'm sure there was a percentage that were lucky. You know, there's always backroom abortionists and stuff like that that we won't hear about. And I don't know, maybe, you know, I've never really sat down and discussed with my parents their sexuality because I don't think that's my business.
Why are the young people in society nowadays so preoccupied with
Because
the
there was a
sexual
lid
act?
on the whole time. They put the lid on and they would talk about it. Just take it naturally. I explained to my kids, and the 23 years old, we sat in front of the TV and watched how a baby comes out. And they didn't even ask me how it comes in, so I was glad, but it came later. And you can always talk to them and you never have a problem.
There's still a preoccupation though with the actual sexual act at a very young age.
The parents make a fuss about it.
North American society makes a fuss about sex.
Yeah.
Various religions that will remain nameless make a
Yes.
fuss about sex. And that comes into it. It's not really part of the AIDS epidemic as such, except that we can't converse comfortably about.
But are our children, are the sexual hormones in young people becoming more active at an earlier age, and why?
No, I think it's just more socially acceptable to express it. Whereas in the age of shortly after the war, when my parents were actually late teenagers, during the war was when my parents were teenagers, it wasn't as acceptable to express it. So I don't know what went on back in the early 40s.
But now, there seems to be a maybe, have you watched the MTV videos? Whoa,
Could that be part of it? I don't know.
I don't know. Whoa, they are pretty.
Have you watched the daytime soaps?
The videos are worse.
Oh yeah, I know, but
Because the
daytime
videos,
soaps, I don't watch them.
the music, I watch them just for my own, you know, curiosity, and education, to see what young people are watching. And it's pretty explicit, and I don't mean explicit in a way like in the soaps. It seems to be even handled with more taste than in the musical videos.
But that's a cheap way to entertain the whole nation, with food and sex. So we are always happy. Yeah, I would do the same.
Everybody's always diseased.
That's why, so my concern is
Yeah.
that young people be educated that there's another side to all that glamorous part of it.
And I think slowly, the entertainment industry is realizing it. It's not as acceptable anymore in the movies to have people jumping into bed. Or now they will mention the word condom before they jump into bed.
We still don't see condom ads on our television.
No.
I've seen one in Nelson, one condom ad on BCTV in 4 years.
But I think in 10 years, this is so boring. Now it's just escalating and the pendulum will go back and then it's somehow normal. And we all know what sex is and how it gets treated. If you are sick, it's not so scary anymore.
Well, the problem
It's
is,
never normal, the pendulum always goes
Yeah,
one way.
maybe.
If you look back historically, you know, there's always repressive or promiscuous.
well, unfortunately, what's happening in some areas, the moral majority is coming out and saying, no condoms, no sex education. They don't find out about it until they're married.
And this is bad.
The other extreme, right? The other end of the pendulum swinging through.
That's not good either.
It's not going to work. There has to be some education done properly and done effectively. Again, I don't think we're going to make a big dent in promiscuity among heterosexual people until more people start dying of AIDS. And by then, you know, it has leveled. The epidemic, as they expected the numbers to keep going up through the ceiling, hasn't. It has leveled off due to the awareness in the homosexual population. The heterosexual slide or graph is still on its upswing. It's still not a reality to people that heterosexual people can get it from quote unquote normal vaginal sex.
Well, all I can say is, I'll tell you, I've had a son die in a car accident, and I've had a son die of AIDS.
Oh.
And I'll tell you, AIDS, HIV positive, AIDS is the worst thing. It will destroy a family, I'll tell you. And I don't mean destroy a family, it destroys some families because it's a stigma of it. They won't even talk about it. They won't even acknowledge that their son has died. Because to acknowledge that your son has died of AIDS is acknowledging that he's homosexual. And there's lots of families that don't want to do that. It is the most devastating, emotionally and physical disease imaginable. My son had so many different things. Things that people wouldn't dream in a million years that you could, that you would, you know, people think, well, AIDS, they get PCP, they get the pneumonia, you know, probably die. You know, there's such a multitude of all different crazy little other things. We were fortunate, my son was fortunate, that he didn't have to linger through a lot of different things. He'd had his spleen removed, so his immune system was even lower. And the funny part is, they don't know what he died of, but he got a case of the hiccups. And he had the hiccups for 4 days, and it wouldn't go away. They put him in the hospital, he was very ill, they didn't know what was wrong, and then he died.
Mm-hmm.
Now who would think that the hiccups would kill you, you know? So that you have to just educate the young people. I mean, it's just
And we have to remove the
horrendous.
stigma.
Yeah.
And remove the stigma.
And people like you are doing a good job on that. So, I mean, you've
Oh, I
come
try
through terrible
to. There
grief,
is people.
but I would just want to commend you for trying to help others not have to go through that. I mean, you are.
I think you either go one way or the other. Actually, you know, I know people that have a strong commitment, that have had friends and brothers, and, you know, die, and then you have people that they will never speak about it, and you would never know, and you will never know.
Yeah.
You see, because of the stigma that this disease seems to carry with it, and I think it's because of homosexuality, and that's why heterosexual people don't really take it seriously. They really, really don't.
And they're stupid.
I never get it what it's so dangerous about homosexuality. My God, it's another preference. Just let them do. The world is overpopulated anyways. I think that's very healthy. There should be more gay people in the world.
That is a theory, that is nature's way of controlling population.
What I was reading in here that I found quite interesting, that I never realized, Tchaikovsky, Leonardo da Vinci were homosexual.
Yeah.
Oh, there's a book.
Yeah, that I'm sure.
There's
is
a book
amazing.
out that tells you.
And not
all the
that,
pictures.
so, you know,
Just leave them
I'm,
alone and that's it.
you know, I'm
Yeah.
Jim and I'm white and I live in North America, and to say homosexual or heterosexual, bisexual, who really cares? You know, I act a lot. I've acted since I was a youngster, and I've worked very closely with homosexual males. You don't get hit on. You don't get converted. Great group of folks to hang out with.
Yeah,
And that was never an issue, that they were gay. We were actors. We did a show. We went out and drank beers afterwards. We had a good time.
I think people tend to forget too, like, you know, I mean, my son had a partner. And I think in the heterosexual community, then there's a great feeling of sympathy for, you know, either or a partner, because they're heterosexual. Whereas in the other aspect, well, you know, so he died. He died of AIDS, so, you know, then it's over, you know. There's a partner involved, and there's parents of partners, and there's, you know, it's exactly the same type of lifestyle that we all live, except a different sexual preference. So, in a way, if the heterosexual community does not listen to the education about it, it will affect even more people, because there's children involved then. And there was a program in London, Ontario. They have a clinic that's dealing strictly with families that have AIDS now. And there was a couple, they'd both been married before, then had single lifestyles. She had a child from a previous marriage. Did you see that?
No.
She had a child from a previous marriage. He didn't. They met, you know, got married. She didn't know, or he didn't know. One of them brought the HIV virus to the family, to the relationship. They had 2 more children before they found out. The mother, the father, and these 2 children all have AIDS. The only child, and they will be left alone with no parents, brothers and sisters, is the one that refers me.
We've got a long way to go. I'm always quite willing to speak on this subject, anything else to do with microbiology. And I'm, trying in my time to do as much education as I can to hit the groups that I think need to hear it. But it's doing it in an effective way because it's the teenagers who are invincible to do it. One of the things that I'm doing through the hospital that might appall some parents that are watching this, that some of the biology classes will come through the hospital for tours of the laboratory to see our equipment and what we do in biology. And I always make sure that I have time to give them a tour of the morgue and show them where you end up if you drink and drive or do stupid things, or be a typical teenager and get unlucky. This is where you can end up. And I do a 10-minute presentation in the morgue with the teenagers. And the teachers inform me, the feedback that they get, that that's the most effective part of the entire tour. They don't remember anything else, except the morgue and how gross it is. And maybe that's catching me. Maybe it'll stop somebody from drinking and driving.